Okay, so very good afternoon, ladies and gentlemen. On behalf of Herbal India and my team, I, Rakhi Bakshi, welcome you all. We have been talking to a whole lot of experts in this pandemic and which is facing us directly in front of us, as we have also discussed and shared earlier. It's a difficult time for all of us because we are not only losing some dear ones also due to this deadly disease, but also so many of us are suffering right now. They're battling in hospitals, but we at Herbal India are only trying to get more insights and inputs and information from experts so that you all can benefit from that information. So this is a knowledge platform also in that sense that we're providing to you. But of course, as Herbal India, we look at gender, social, contemporary, and current affairs issues. We partner with Policy Center and Gender Lab of Miranda House, which of course looks at policy and research in that area as well. We are very, very delighted today to have a very esteemed speaker with us, an expert in his own right. Dr. Alok Thakkar is the HOD ENT of AIMS. Of course, he will be talking about COVID, but about the specialized, dangers, so to say, to cancer, to other diseases, and how in this time a patient or a normal person also can really take care of oneself and take advice from experts like him. So I'm truly delighted, Dr. Thakkar, to have you on this show on Herbal India.
Thank you. Thanks for having me.
So, I thought it was a very relevant time to talk to you also because COVID-19 second phase wave is right now here. And one of the things that directly concerns us here is, loss of smell. I would first come to that. And anything which is entering right now in terms of the virus and its connection with the human body directly deals with your area of specialization. So, how would you really look at this whole critical connection right now, Dr. Thakkar?
So the sense of smell is an underrated sense. We obviously give so much more priority to our senses of vision and hearing and touch. But in evolution, if you look at animals and mammals, then of course the sense of smell is a very major way as to how they perceive the world. We underrate it till, of course, we tend to lose it. And many patients have had this issue with the sense of smell and by corollary the sense of taste, which unfortunately is very frequently lost with the COVID-19 infection. So as many as 40%, 50% of patients can lose the sense of smell. There was a brief period when it was sort of proposed that maybe a test of smell would be a better way to check people who have a COVID infection rather than to check their temperatures when they sort of enter into public places. We still end up checking the temperatures of people when they enter public places. But for a brief moment, it was invoked to propose to check the sense of smell.
And another very important thing, the first symptom that we actually look at apart from fever is the sore throat aspect. Would you like to again see a connection and talk about it?
So yes, fever and sore throat are frequent early signs of a COVID infection. Of course, there can be many other causes, but in today's context, certainly the first thing that comes to mind in people's and physicians' perspective is to think about COVID. It is the most prevalent infection at this moment in time. It's generally minor, doesn't last too long, doesn't give too many symptoms, but occasionally patients can get very difficult and very painful sore throats, which can last a couple of days. Oftentimes, as we know, the COVID infection settles down after the first sore throat, and in most situations, 85% situations, that is all that is there to it. I mean, you get a mild fever or a fever which lasts you a couple of days, maybe some myalgia and maybe a sore throat, and it settles down. The lack of smell is a very specific feature because that's not generally seen with other illnesses, and if sort of that comes through, then that is almost diagnostic in today's day. Fortunately, it recovers almost always, but it can be very disabling because a lack of smell can be occasionally dangerous because you may not smell things like a leak of gas or something. But it's also very disabling because you can't quite taste a lot of things. A lot of things we taste are actually dependent on the sense of smell. So, for example, coffee is not just the same without the sense of smell, and people find it.
And also, we have this lack of taste or smell in this particular second wave. Is it true?
So I didn't quite get the question, but to my mind, there is no real difference between the first and the second wave in this aspect.
Okay. Okay. What would you also say that how, as a specialist of this particular area or body that you're looking at, um, what kind of, precautions people should take, and what is it that they must know according to the study, the latest ones?
So I think the precautions are well listed out. The issue is in changing behavior, not in knowing. I think most people now know what you need to do. The issue is that we are nevertheless not being doing it because people always tend to believe that risks are. I mean, there's a denial to the risks that you yourself face. So the to dos are very clear. I mean, they've always been there for the last year and a half, which is basically that you shouldn't be too close to other people and you shouldn't be in the vicinity of other people without a mask. So certainly, like when we go to work, we have a mask on. The days are gone when we would share a cup of coffee or a cup of tea or a small snack with other colleagues. We don't. I mean, you have to be on your own. You just can't get your mask down. You shouldn't be speaking with your mask down. And having a mask serves two purposes. We tend to restrict it to one. The mask is there so that you don't get the infection, but the mask is also there so that you don't give the infection. I mean, it's a reality that too many of us are going to have the COVID infection, which is asymptomatic, and you may get it and not have a symptom or feel ill, but you could well be transmitting it to others. So you should be wearing a mask all the time when you're there as a responsible person, so that you don't give it to others. Is almost like driving on the left side of the road. I mean, if you wear your mask, you protect others, and if all of us protect others,
Sure.
that's
Another thing which came to be observed is that this time, and my little knowledge says that, the airborne capacity. So, how this time the second wave saw difference in terms of how the virus behaved, and what were the became exactly the entry points for the virus to enter. I mean, so through your expertise, how would you really look at that? That what was the difference in terms of the nature of the virus this time and affecting areas?
this time we had a very very big wave, and of course the reasons for that could be that we had a virus which was slightly different in terms of its uh, of its genetic makeup, and so we weren't as immune to it as we thought we had become previously. The fact that viral immunity that you get after an infection is also not a long lasting, lifelong immunity, but tends to peter out over time. And also the very fact that there was a large number of transmitting people or infected people in the early part of April and part of May. And as I said, most of us, many people were not wearing masks, and really the awareness levels had fallen down. So some factors about the virus. I mean, it's a slightly different variant in all probability, which is causing this new waves to every place, and some parts about our poor behavior, and all of it combined has given us what we have.
Mhm.
Fortunately, it's now on the decline again, and that is again because everybody's woken up to good behavior. There's been a lockdown, and also I presume there's been a fair amount of immunity generated in the community as a consequence of the big wave of infections we saw.
Okay, now as an expert in the area also and as a medical scientist, how would you really look at these connections? For example, sneezing, of course, a phenomena, but what is the kind of sneezing happening? A, B, also that other kinds of diseases which came up. For example, I was talking to someone who said that, maybe it could have been laryngitis. So, but then how does it kind of also becomes interrelated? I mean, would you like to throw light on how somebody can really understand what's happening?
So I'm not so sure I get the question,
No, no.
but
So for example, the sensitive difference, I would say, how do we differentiate? For example, right now, we'll also see seasonal diseases coming up. So how does one really get a little more aware about differentiating these things?
so normal colds generally give rise to nasal symptoms, which includes sneezing and a runny nose. And the COVID symptom is generally more related to the throat rather than to the nose. And secondly, if you have a bacterial infection, it's likely to give you a higher fever and give you lymph nodes or swellings on your neck, which again you don't tend to see with this infection. And the biggest pointer really which is coming out is that, if you have a history of contact, and if there's a history of contact with COVID, then that quite sort of seals the picture. Testing obviously confirms it.
Sure. Talking about the cancer part also, since that's also a major area of concern. How would you really look at, according to the latest study, what is the kind of prevalence right now? I mean, yesterday we were talking about, since 31st is anti-tobacco day, saying that how people are dying because of smoking and because of all these factors of addiction to nicotine. Likewise, for cancer also, what would you say that what's happening at this stage in India? Due to the progress, maybe we have been able to deal with things much better, but where do we stand?
So yes, it's World No Tobacco Day, and I think we often sort of deflect from our major problem by talking about smoking. Smoking and tobacco are not quite the same in our country. There was a time we have been fairly good with controlling smoking, and unfortunately, a lot of our tobacco usage has now converted from smoking to oral tobacco. In fact, one third of adult Indians use tobacco, about 50% of adult males use tobacco. The majority of this is oral tobacco, not smoking, because smoking is now looked down upon and discouraged in public places, at least in many urban areas. But if you look at our figures, then the majority of people, 22%, are actually using just oral tobacco. Another 9% are smokers, another 5% do both. Um, and there has been a shift. So 20 years ago, the commonest cancer in India was lung cancer in males. And the reason for that was that we were smoking tobacco. And now, no, now oral cancer or mouth cancer is by far the commonest cancer. It's an epidemic. It's a terrible epidemic. Along with oral cancer, we have pharynx cancer, larynx cancer, throat cancer, so to say, and we have nasopharynx and nose. And of course, smoking causes stomach cancer, smoking causes bladder cancer, and tobacco, not smoking, but tobacco also causes so many other illnesses, be they be related to heart illness or chest illness or strokes and that kind of thing. And by sort of restricting it to smoking, I think we deflect the real issue, which is about tobacco by smoking, but which is really far greater about oral tobacco. Nowadays, in all sections of society, it is oral tobacco which is the problem. The dose of nicotine that goes in with oral tobacco is probably higher than the dose of nicotine that goes in with the smoking cigarette. The rates of cardiovascular disease, the rates of strokes, the rates of, of acid dyspepsia, the rates uh, of vision loss and retinal problems and even hearing problems are all related to this issue. And of course, uh, it is generally believed that if you're someone who uses tobacco, you would live at an average of 6 to 8 years lesser. I mean, I've just told you about how things can go wrong and you can have a poor quality of life, but also a poor quantity of life. Cancer is just one aspect of tobacco. It's, of course, a major aspect. And we being primarily head and neck cancer surgeons for oral cancers, we obviously see the after effects of oral tobacco day in and day out. It's a terrible disease to have. It's a terrible disease to die with. It's a terrible disease to live with. I mean, even if you get cured, it's not easy, or it sort of doesn't happen without costs. And the worry is that people are unaware of it when they start tobacco usage, which is generally very young. People are starting tobacco usage at the age of 10 to 15, and are totally incapable of coming out of it because they're addicted to it after that. So once they have the awareness, they are unable to come out of it. And when they start it, then they are not aware of its ill effects. And I think we have failed.
So in a country like India, would you like to really sketch a pattern or something which is very specific to our country, or maybe a range of developing countries, sir?
So the pattern, as I said, is that our problem is not really the smoking problem. That is part of the problem that the world or the globalized world of the West talks about. Our problem is a little bit different. And we need to look at it a little bit differently with regard to oral consumption of tobacco. That is the difference.
Okay. Coming down to again women and young women, you talked about children. Would you again see a pattern that how females are more prone, or maybe they should be more aware? We're also talking about both exposure, understanding, immunity. Actually.
So when we come to smoking and women, obviously more women smoke than used to. Many women in the rural areas and also use a fair amount of oral tobacco. 20% of Indian adult women use tobacco, which is a fairly high number. People have tended to use tobacco to limit their appetite and keep their weights in control. And of course, it's not quite healthy when it's short term, but it's not quite healthy. Um, it is. I mean, the women have the same illnesses that men have.
Okay, so sir, since you are, and you, in fact, I know that you are very busy and handling a whole lot of patients right now. In fact, hospitals are filled with people who are coming to get treated. What kind of tips would you give in terms of coming to hospital, taking care themselves at home, or how to be better aware of the whole situation as far as both cancerous situations are concerned, and also not exposing oneself to such situations which can lead to COVID symptoms?
So let's. So I think your reference is more with regard to present times and with present
Exactly, sir. Yes.
to the COVID epidemic. Fortunately, things are dramatically better over the last 3 weeks, and today, at least in this city in Delhi, the number of patients has come down dramatically. The positivity rate has also come down dramatically. So, so I can't say we can never return to normal, but we will, I guess, soon be seeing a return to the restoration of services in hospitals and things of that sort. Hospitals take all precautions in because we have to take all precautions for our patients and of course our own healthcare personnel working there. So we have every precaution in place, and of course we have strict compliance with regard to distancing, ventilation, cleaning surfaces, and that sort of thing. Of course, it is not advisable to do any activity which can wait. So I'm not saying that you should be going out there to get your hearing checked at this moment in time. Maybe you could wait another few months to do that. But if you have urgent problems, then yeah, I mean, hospitals will soon be available and would be available to routine services. At the moment, we run our services by teleconsultation. You can still access us, and if you access us, we give you a call and take it from there. And if required, we do call you to the hospital to see you. And if you think we can defer, we defer for a moment.
Specifically relates to mouth cancer is that what would you advise? How much of the danger it is to be handled medically in terms of medicines, or they have to go through procedures? So, what is the kind of ratio that you are looking at?
So you're coming in the context of mouth cancer, and that is the dominant or tobacco-related cancer at this moment in time. 50% of cancers in this country are related to tobacco, and that really tells you. So mouth cancer, if you get it, then almost always is surgery, which is the best treatment, which is considered for it. There are treatment options, of course, of surgery and radiation and chemotherapy. But in this particular cancer, the lead is with surgery on most occasions. Sometimes surgery, sometimes or oftentimes, when the disease is a little bit advanced, surgery um, has to be
Okay,
linked to radiation too.
okay, and
And
as we are really telling and appealing a lot of people not to use tobacco, and it's a worldwide pledge that all of us are taking actually, that how dangerous it is for everyone. What would you say that how should we really avoid this addiction? Also, these new methods which are coming in, the electronic ones, how do we not get tempted, and how should we really keep a healthy lifestyle in terms of food and discipline?
so, of course, I mean, the key is here, of course, distraction from getting on. If you are someone who's already been using tobacco or addicted to tobacco, it can be fairly addictive. Then you have to find behavioral patterns to to get off it. And behavioral patterns often means that you need to seek help from a friend who's going to guide you and help you and motivate you to go out of it. You also need to find ways of uh, of doing alternate things at the moment when you have the urge for a smoke. Most people have specific times that they have a pouch of zarda or something that they after they have the meal or something, and you have to find alternate activities which might be in the way of rewarding yourself with a small sweet or something, or maybe going out for a walk or making a phone call to a friend or something. But you have to find alternate ways of distracting yourself from that. Now, drinking water is supposed to help. Um, um, and if all of this doesn't work, then there are actually de-addiction clinics that we run. The government of India runs a de-addiction quit line. It's not quite very much, people are not so aware of it, but it runs a quit line. And our hospital runs clinics for de-addiction, and we help people through. And sometimes we also need to give them medicines to decrease the urge and help them through. There is also what we know as nicotine replacement therapy. Many are well aware of it, things like chewing gum or patches of nicotine, which can decrease the urge for you to have it. But I'm not advising anybody to go down that road without medical assistance.
I thought this is very, very helpful insights that you shared here on a Sunday afternoon. Thank you so very much for sharing your time and being with us on Herbal India. We really wish you all the best, and I'm sure whoever is listening and watching is benefiting a lot from these critical information and inputs and insights. Thank you so much once again, all of you.
Thank you. It's been a pleasure. Thank you.